I just want to read you a couple of segments. I'm not going to put it on the screen. This is from our marketing person on Wednesday, May 8th. Oh my God, he's typing late at night, 11:23 p.m. He wrote. So he says, "Hi team, a great story from today. Make sure you read the success at the bottom in blue," he says. Okay, now, Eric and I set up a table on April 17 at the blah, blah, blah health fair in that area. Dr. So-and-so stopped by our table and we chatted for a bit. He owns and works at a beautiful, large urgent care center in that area and asked me to stop by sometime. I stopped by today to meet him. Very nice and large urgent care facility in a large shopping center with a Target and another physical therapy organization nearby. And then he says he brought me into his office, blah, blah, blah. He was impressed about our diagnostic services and which other clinics do not offer. He was very interested in musculoskeletal ultrasound and EMGs and posted all of our info on his wall in his office. He has a lot of diabetic patients, including himself. He brought his staff into his office to make sure that everyone bookmarks our patient referral landing page on their computers. About 2 hours after my visit, I started seeing landing page appointment requests, one after another, from doctor whatever. Totals for today, that office, 2 patients for EMG, the other office, 3 patients for EMG, and 1 for MSK ultrasound. So, I mean, this is pretty much the kind of success stories that we see time after time after time. So it's absolutely awesome. All right. Are there any other questions from anyone who is attending live here? So if not, I would like to mention that please make absolutely certain that you join us in the next event, in the next webinar and podcast, where we're going to talk about a very important topic. It's going to be about unlocking profit potential, maximizing EBITDA for practice success. And
you see that? There's one question there, Tim. You see that?
Okay, we recently established a relationship with a very large pain medicine group that sees 70% workers' comp. They sent us 4 referrals yesterday, 1 week after our initial meeting. When I reached out to the case manager to get authorization for the EMG and CS, she told me it wasn't approved, and if it wasn't approved, and if it was,
you have to be a doctor.
You have to be a medical doctor. Any suggestions for getting around this? So you will have to look, Matt, at the specific reason they are saying that. If there is something that they have in their policy, and this is the reason they do that, we can, part of the as part of the revenue cycle process that we have, we recommend some steps that you can take about that. I would strongly suggest that you bring it up to Joanne, and then she can reach out to me and we can look a little bit more into that and see how we can help you in this. Okay?
Sent to Joanne, actually, so she should be in touch with you regarding that. So I reached out to Joanne today, actually, so she should be getting in touch with you.
Cool. Okay. Good. So
I responded with letting her know, mentioning that it's part of our Practice Act and that it's accepted by Medicare and blah blah blah. I know that in Illinois, like the work comp laws in Illinois don't allow the case managers to direct care, so patients can go to any provider they want.
Good.
But I don't know, if they can distinguish between something like this with a medical doctor versus a PT. So I'd have to find that out.
So yeah, we'll help you on that, and we're going to check from our side also. And of course, I mean, if there is a legal violation that they have, or this specific case manager is working then we're going to refer this to the state insurance department. In the state.
I mean, it was a typical case manager response, filling in and liking to tell people no.
Of course.
But we just established this relationship, and considering there's going to be a lot of these cases, it'd be nice to see if there's a way around it if this comes up again. Yeah,
of course, absolutely. So we'll definitely look into that. Okay, any other questions from anyone? Dan, do you want to just put some information on how people can reach out to you? You can always reach out to www.handsondiagnostics.com, and also if you want, you can reach directly Dan Sage at 561-441-5744. He put his number, or email to him at dan@iHUDS.com.
Yeah. I would. If anyone's interested, I'm more than happy to help navigate it with you and see if it's a good fit. I mean, I'm excited. We signed up 4 partners in less than 4 weeks, so more and more private practice owners are looking ahead, forward thinking, how to navigate, what's happening to us in private practice, and I'm excited, and I'd love to talk to anybody.
Awesome.